5 years ago, I was pregnant with twins, and so I delivered the babies early at 28 weeks. One of our twins passed away shortly after birth, and the other is a thriving 5-year-old. Not knowing anything about prematurity before I gave birth, I realized there's not much out there. So when you actually deliver preterm infants, it's not just in the hospital that they're fighting. They fight every day of their lives.
Although prematurity could be significantly reduced and as much as 75% of preemie deaths could even be prevented, we are seeing some of the worst, most alarming statistics we've ever seen in history. In fact, preterm birth is the leading cause of death in kids under 5 across the world. In California, we have some of the worst rates. There are 15 million preemies born each year. Unfortunately, 1 million don't survive, but of the 14 million that do survive, they face lifelong obstacles. This is an epidemic, and it's one that has been silent for far too long.
I think we need to think holistically about this issue. There has been and continues to be a disconnect to some of the environmental challenges in those neighborhoods. We're not thinking about the social emotional support that are lacking in those communities, domestic violence, and all of the other challenges that those historically distressed communities are facing. I think it'll take us to places that we had not considered.
I feel very strongly about improving research and clinical care in preterm birth. A, because I was a preemie, and B, because it disproportionately impacts Black and brown people. And I really feel like there are modifiable behaviors and modifiable interventions that can improve the impact of preterm birth.
It may be twins, high blood pressure, diabetes, what you eat in your diet, in fact, your general health before pregnancy, or how far apart your pregnancies are spaced. But having a healthy pregnancy is so much more than just a medication. That's why, to really turn the curve on preterm birth, it will take a village. It's about having a conversation that includes, first and foremost, the mothers, the families, the communities, along with the providers and the researchers, the policymakers. UCSF is honored to lead this exciting initiative where we get to look at things differently. This is an opportunity to close the tremendous, unconscionable gap when it comes to birth outcomes, and together with the women and communities who are affected by this disease, profoundly achieving something we could never do on our own.